Hi. I'm robo-Suzie and today I'll talk to you about coronary heart disease. Signs, symptoms and heart risk factors. Also don't forget to subscribe for more tips in the future. But back to our topic. What is coronary heart disease? Heart disease, or, more specifically, coronary heart disease, CHD, is caused by a hardening or narrowing of the arteries which surround the heart. These blood vessels supply fuel and oxygen to the heart muscle, allowing it to pump blood to all the organs in the body. Aging, poor diet and an unhealthy lifestyle cause fatty, cholesterol-laden deposits to form in the smooth artery linings, a process which can even begin in childhood. What are the signs or symptoms of coronary heart disease, CHD? Angina. Angina is often the first sign of heart disease, signaled by pain across the chest but sometimes in the shoulders, arms, throat or jaw. The narrowed coronary arteries reduce the rate at which blood can be delivered to the beating heart muscle. The pain is usually a heavy or tight one, generally lasting for under 10 minutes. Angina commonly occurs with strenuous activity, as this makes the heart beat faster and increases its need for energy and oxygen. The discomfort of angina occurs more readily in cold, windy weather, after eating a large meal or with excitement or stress. Rest, relaxation and, for some, using angina medication usually bring relief in a few minutes. The situation becomes more serious when angina occurs at rest or with minimal activity or comes on with increasing frequency or severity. Heart attack. A heart attack occurs suddenly when a blood clot forms in a narrowed coronary artery, completely blocking blood flow and thereby causing an area of the heart muscle to die. Commonly, the pain is severe and crushing, lasting for longer than 15 minutes and not relieved by rest. The outcome depends on the site and size of the artery involved and the affected area of the heart muscle. When only a small area is involved, there is a good chance of a full recovery. However, if larger areas are involved, the heart attack may prove fatal or result in an incomplete recovery as the heart muscle loses some of its power and strength. Sometimes the heart will stop altogether or abnormal heartbeat rhythms, arrhythmias, take over, and both of these scenarios can cause sudden death. Stroke. Most incidences of stroke occur in a similar way to heart attacks, but the arteries concerned are those that supply the brain. Stroke occurs when part of the brain has been deprived of blood flow, usually because of a sudden blockage in the artery caused by a blood clot. Many strokes can occur when the brain is briefly deprived of its blood supply but manages to recover within minutes. People who have had heart attacks are at increased risk of stroke and vice versa. Classic heart risk factors for coronary heart disease. Some heart risk factors you cannot change: age. The older you are, the greater the risk. Male sex. Women are at lower risk before the menopause. Family history, especially heart disease in a close relative under 55 years old, man, or 65 years old, woman. Ethnicity, for an example, being South Asian. Some heart risk factors that can be reduced, controlled or eliminated: high blood cholesterol, high blood pressure, diabetes, being overweight, smoking, lack of physical activity. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.